Good evening, I'm Katerina Georgieva. Here's what's making news right now.
When we compare Windsor-Essex to other levels, we see that Windsor-Essex still has higher rates of low income compared to the provincial and federal averages, particularly for children and youth.
I can't tell you how excited I am to finally be able to give her some protection other than what she got from my getting the vaccinations while I was pregnant.
I really didn't think that anything was going to come of it. I thought perhaps that it was just going to get swept under the rug. It was quite the opposite, actually.
Thanks for joining us. Fewer people are living in poverty in Windsor-Essex compared to 5 years ago. That's according to new Stats Canada data released this week. But the local United Way says there's still a lot of work to do because 1 in 7 local children still live in low-income households. The CBC's Jason Vio is on this story and joins us live in studio now with more. So Jason, how does this compare to other areas?
Well, the number of people under the age of 18 living in low-income situations in Windsor-Essex is higher than the provincial and national averages. That number was 14.5% in Windsor in 2020 and 24% in 2015, at that time the highest in Canada. Experts say this means more kids here will experience food insecurity and barriers around education.
It means is that we're going to have generations of young people growing up without access to opportunity. That has implications for their future employment and their future earning potentials and our ability to grow our economy and to fill those really important jobs that we have.
Local poverty rates dropping is also a good thing. As we mentioned, rates declined by 9.5 percentage points over the last 5 years, but that's a snapshot in time in 2020 when there were significant government supports due to the COVID-19 pandemic.
Jason, what can be done to address these rates, which are higher than average, of local children living in low income?
Well, Alicia Fleming, who we just heard from there, says the pandemic has shown the importance of those government supports to lift people out of poverty. She says those need to be continued from all levels of government in a sustainable way, but others say it boils down to good paying jobs.
We've had a lot of great announcements, and I'm encouraged by things like the Stellantis battery plant and things like that. You know, it's about how do we get people into jobs that actually pay wages and pay incomes that allow people to support themselves, their families, and thrive and survive in the community, more than just survive in the community.
Now, when it comes to the information released this week, the United Way says it plans to take a closer look to better understand which racial groups and neighborhoods in our community are most affected by poverty.
Thanks for this, Jason. CBC's Jason Vio live in studio for us tonight. Health Canada has approved the Moderna COVID-19 vaccine for children under the age of 5. It's the first to be authorized for use in this age group in Canada, and it expands eligibility for the vaccine to nearly 2 million children across the country. CBC's Stephen D'Souza has the details.
For Danielle Wheel, it's like a huge weight is about to be lifted off her shoulders, now that Canada has approved its first COVID-19 vaccine for small children.
We've been hoping and waiting for the chance to have the kids protected as we have been since the vaccine came out for adults.
She has 3 children, all under the age of 5. Emmy, one of the twins, has cystic fibrosis. A bout of COVID in April led to complications. Emmy spent 9 days in hospital, so a new vaccine can't come soon enough.
With having absolutely no way to protect her other than isolating and wearing masks all the time, this is a big step for us. We're pretty relieved.
Today, Health Canada approved Moderna's COVID vaccine for children aged 6 months up to 5 years old. The dose is 1/4 the size of the adult dose. Children will need 2 doses. Moderna recommends 4 weeks between shots. The National Advisory Committee on Immunization suggests 8 weeks. They also say it should be taken 14 days before or after other childhood vaccines. Health officials say the vaccine created an immune response similar to that seen in older teens and young adults. Reactions were mild to moderate.
The most frequently reported adverse reactions were irritability or crying, pain at the injection site, sleepiness, loss of appetite, and fatigue.
While experts say COVID-19 is still generally mild for the majority of children, the high infection rate of Omicron meant more kids were infected and more hospitalized. Pediatricians know they'll have to convince some hesitant parents.
It's not a cold. It does have significant implications for children, and the availability of this vaccine is wonderful because it really will reduce the risk of bad outcomes in children.
With some provinces experiencing a seventh wave of the pandemic, he says protecting children has a bigger impact.
The more people who get it in the community, the safer the community is.
Shots should be coming soon. Some provinces like Ontario and Saskatchewan tell CBC they could start receiving the new vaccine next week. Stephen D'Souza, CBC News, Toronto.
Locally, the health unit is preparing for these doses. It's reviewing recommendations and awaiting guidance from the provincial government. Some parents in Windsor are excited about the announcement. Dana Menard says she'll be first in line wherever doses are available for her 6-month-old daughter. She says waiting for this moment has been tough.
Really awful because there's this mindset these days that the pandemic is over. I see this verbiage all the time, people saying, well, post-pandemic or now that we're through it. And it's like, we're not through it. First of all, not everybody has equal access to the protection of the vaccines. I just want to give her weapons in the arsenal to fight this pandemic.
Meanwhile, people 18 and up can get their second booster shots as of today, but you may have trouble finding a site to do it. Some pharmacies are still waiting for doses. That's as new weekly numbers show the impact of the seventh wave. Lorenda Redekop has that story.
Technically, I am eligible, but now where do I find it? And, how do I get it?
JC Rahala is eager to get her fourth dose, but her local pharmacy doesn't have them. Her father lives in long-term care and just tested positive for COVID. As an essential caregiver, she is still allowed to visit with full PPE. She wants to be as safe as possible.
Hey, if they tell me to take 10 doses, I will do it. So at this point in the juncture, it's really important that I'm able to see my dad. It's important that I'm at my workplace and, I'm safe.
This pharmacy is out of stock too, far from the only one in that situation.
We're waiting on supply. Our distributor has not supplied us with vaccines. There's a delay for the second day in a row.
He's hoping his shipment will arrive tomorrow, or if not, then next week. He's been fielding questions from people and has a sign reminding people the government isn't strongly recommending the fourth dose for all adults under 60 and to check with their doctor.
We just put the note out there, and at the end of the day, it's a case-by-case sort of situation, but this is just a general recommendation based on what was conveyed to us from the government in the first place.
Downtown, this Toronto Public Health Clinic did have supply, but as for the government's messaging on fourth doses,
it seems a little bit confusing, but at the end of the day, to me, it seems like if you can get the dose when you can, you might as well just get it.
As a senior, one woman was already eligible before today and came to get her shot.
Because I believe it will protect me from COVID-19. That's the only reason.
The latest eligibility convinced one man to get his third shot.
Because the fourth dose is now available, I'm backtracking and trying to get caught up.
All this as new weekly numbers give a picture of this seventh wave. Test positivity is at almost 15% today. The number of people in hospital rose sharply to 985 from 712 a week ago. That's up 38%. People in ICU with COVID is up, and 39 more people died. In a wave that the chief medical officer doesn't expect to peak for another 2 weeks. Lorenda Redekop, CBC News, Toronto.
Just a warning that this next story refers to suicide. The Chatham-Kent Health Alliance is making changes after the death of a mental health patient earlier this year. The family complained, saying more should have been done to prevent his death. But now, for them, some relief that new policies might help other patients.
I'm so glad these changes are coming about for all the people of our community. So many people said to me, oh, I bet you nothing's going to happen. And so I was a little hesitant, a little negative, but that was not the case at all.
Then Pembroke's son, Robert Martin, died by suicide in April in their family home after years of struggling with mental illness. Just 11 weeks prior, he had been involuntarily admitted into Chatham's hospital, but was released early by his psychiatrist. He was diagnosed with ADHD, bipolar, and substance abuse leading to psychosis. Following the complaint from the family, an internal review led to 4 recommendations to be implemented. A letter outlining them was shared with CBC by Martin's mother.
They based everything on everything that happened to Robert during his stay at the hospital in January.
The hospital told CBC in a statement that a quality review is usual protocol whenever there is an unfortunate outcome such as this. It said all team members involved came together to examine the care Martin received with the purpose of improving the quality of care. The first action, discontinuing phone appointments for mental health patients. Martin's appointments were all by phone because of COVID. Now, video or in-person meetings only. The second, implementing a system for appointment reminders for patients. Martin had missed a number of appointments to receive antipsychotic injections. Third, a review of the transfer of care process if a request is made for another psychiatrist. Martin had asked for a new doctor, but was denied. And fourth, a clinical review of the discharge planning process on the inpatient mental health unit. When Martin was discharged, follow-ups didn't take place until 2 weeks later.
I mean, they told me yesterday these changes happened because I said something. Imagine if more people said something, the more changes that would happen.
Do you think that these changes might help save some lives?
I hope so. Even if it just saves one person.
Van Pembroke also filed a complaint to the College of Physicians and Surgeons of Ontario against Martin's doctor, but the regulatory body could not speak to it. Next, she'll be pushing for more funding for mental health supports and more awareness around suicide, all while she grieves.
So I'm just trying to take it day by day.
The memory of her son, though, continues to put a smile on her face.
Robert, he was always a smiling kid. You would never known he had such mental health problems, but he was a kind, sweet kid. Every day I'm always like, oh, my sweet, sweet Robert.
For more on this, I spoke with a local mental health educator with the Canadian Mental Health Association. She praised Van Pembroke for speaking up and creating change. Here's her take on the recommendations.
I thought the recommendations were spot on and really essentially encompassing the goal of meeting someone where they're at. And what I mean by that is, having an individual who is currently experiencing a crisis or needing assistance and support, it's wanting to have wraparound care. It's where we're meeting people where they're at. Let's say if it's video conferencing, or now we're encouraging, no, we need to have you face to face because you're important. That sends a message, right? Another, like just check-ins, like being able to check in, also the way discharge planning would occur. So I think that was the best recommendation of all, in the sense of having those reminder checkups, right? Like let's say somebody has just been out of the loop for 2 weeks. Wouldn't it feel absolutely wholesome and wonderful to get somebody to call and say, hey, just checking in. How are you feeling today? So I think the hospital, I think it was a beautiful, they're beautiful recommendations, and they're hopeful recommendations that is really going to start the path moving forward in having more individuals share their story and let us know what could we change, what could we do better. We need to know.
And what do you make of the timeline and how the hospital has responded to the initial complaint from the family? Like, to see a hospital respond with actionable items within 3 months, is that a normal response? Is that a special response? I just like, how should we, what should we make of that?
I personally don't know if it's a quick response, a slow response. I don't know. I found, like I shared to you right away, it made me smile and happy to hear that someone, Leonie expressed her concerns, advocated, and look what came about. These approaches, these recommendations are definitely the start and really going to be helpful for those individuals in the Chatham-Kent area.
And if you or someone you know needs help, you can reach the Canada Suicide Prevention Service at 1-833-456-4566. And you can also reach the crisis line at Hotel Dieu Grace at 519-973-4435. The threat of avian influenza has Canadian officials cracking down on fresh poultry products crossing the border. Items from certain states are banned from entering Canada, and that includes product from Michigan. One cross-border shopper we spoke with says he was unaware of the rule when he crossed the border today with some chicken breasts and eggs, but he was not stopped by border officials, even though he declared them. He says that he saves a lot buying groceries in Michigan. For example, he says 18 eggs costs him less than $2 in the U.S. compared to more than $4 here in Canada. But for the time being, that's where he'll have to get them, but he's staying thrifty.
I mean, I don't usually go to Costco, but like most likely gonna go to Freshco, Food Basics, Walmart, one of those three, you know, or what is the other one? No Frills. I don't know, wherever there's sales going on. Yeah, like I gotta find out where the sale is and then head towards there.
Wisps of smoke at the Windsor Arena drew a large response today. You can see some faint smoke right there as firefighters get on top of the arena to inspect the damage. The call came in mid-afternoon. Reports that the downtown building, also known as the barn, was on fire. The building has been previously used for storage by the city of Windsor. Firefighters did not discover any flames when they entered, having to cut through plywood and a steel door to get inside.
There is nothing, there's good visibility inside, there's a light haze. We're just trying to find out what the cause of that is. It's causing us a little bit of effort to get in and see where it's at. There's visibility underneath. There's been no big changes in the last hour. It's just trying to figure out what's causing those wisps of smoke.
And this is what remains following another fire earlier this morning on Tuscarora. People forced out of their apartments because of the flames. No word on the cause at this time. We're also hearing now of another fire in Sandwich Town. It's on top of the roof of the Sportsplex, and we'll keep you updated with the latest as it comes in. Live look outside there, a beautiful day. We're just gonna have only a few clouds in the sky overnight and sunshine tomorrow. Colette Kennedy will be here right after the break with more. Stay with us. Colette Kennedy is here now for a look at our weather forecast. Colette, another beautiful day, blue skies, hardly a cloud in sight. How long is it going to stay for?
I know, isn't it something, right? Like such enjoyable conditions for us. We know that we do need some rainfall and we're really still carrying on with this deficit. However, it's kind of nice weather to just be outdoors, and also when the humidity's not too significant, our dew points have been relatively comfortable, so things looking good. I know it says satellite and radar imagery, but actually we're just taking a look at the lightning data here and just showing you where there is some activity well off to the east with some of the lightning strikes, to the west of us as well, high pressure in between, really kind of protecting things. Now that is going to change a little bit, so we should still likely see a nice day as we head into Friday. I do have a bit of fog in the forecast for tonight, so just be aware that we could see a bit of patchy fog and some reduced visibility, but otherwise you're talking about clear skies. A little bit of that lingering into the early morning hour, and then it will be burning off. So just to look at your temperatures, because the dew points are low, so it's not just the clear skies, but that the atmosphere not holding a lot of moisture, it does allow those temperatures to drop off, and really, really comfortable numbers that we have here through the overnight. Now, where things are changing a little bit is late in the day tomorrow, we'll see the increase in cloudiness, okay? So it will come in, and then we get into a chance of some showers, even a few embedded thunderstorms possible overnight Friday, and then kind of lingering into Saturday. I don't think it'll be as bad as this, meaning as quite as much cloud cover on Saturday. Kind of a mix of sun and cloud in there, but that slight chance of showers, 30 degrees. Are we going to see that humidity coming up? Yes. Are we going to get into some better chances of some precipitation as that system from the States kind of noses in? Yes, that answer as well. And you see it there in the 5-day, Katarina.
So we got to soak up that sun while we can then. Thank you so much, Colette.
You're welcome.
When we come back, we're going to take a look at how some businesses are continuing to struggle to find workers. Stay with us. Welcome back. Employers across the country say they're having a hard time finding workers. High growth businesses seem to be struggling more than others. The film industry is a good example. It's coming back strong as COVID-19 restrictions disappear, and there are concerns a lack of experienced workers could hurt that recovery. CBC's Tim Propp has more.
Today we're just going to dip into the mountains just west of Brad Creek.
Jason Nolan is one of Alberta's top location scouts. His job is to find unique landscapes and other locations that would appeal to film and TV directors. With landscapes ranging from mountains to prairies to badlands, he says Alberta is a filmmaker's dream.
I carry 2 lenses with me at all times.
Nolan works on multi-million-dollar American-backed productions. He says the number of film shoots in Alberta has quadrupled over the past decade and that budgets keep growing. But with only 6 experienced location scouts in the province, it's hard to keep up with demand.
It does kind of hinder productions coming in a way, because if the crew base isn't here and able to support their project, they're not going to be able to complete it.
Industry insiders are worried shortages in skilled positions like set directors, electricians, and script supervisors could soon slow the rapid growth.
The biggest challenge for us who are training people to sort of replace us or to add to the crew is we can't take them on set. In other words, they can't come onto set and shadow us, which is what they need to do in order to qualify to be a script supervisor. So it's kind of a catch-22 for us.
The people who make the hiring decisions place a lot of weight on experience and not very much weight on training. So the challenge is to change the thinking of the people doing the hiring so that they can trust newcomers who have been highly trained rather than people who already have experience.
Getting more people on board is the key to help keeping Alberta's booming film industry on track. Tim Propp, CBC News, Calgary.
We have an incredible rescue story to share with you from Thailand of a mother and baby elephant who were trapped in a manhole. The ordeal began after the 1-year-old calf fell into the deep hole while the mother elephant fiercely guarded from above. Veterinarians were forced to use a tranquilizer gun to subdue the frantic mother. Then, shockingly, she fainted and fell into the drain hole, narrowly missing her calf. A crane was eventually brought in to lift mom out, and then the baby was able to climb out on its own. The mother elephant managed to regain consciousness after vets and volunteers performed CPR, and miraculously, both mom and baby were able to reestablish their footing and return to the wild. That is it for CBC Windsor News. For news anytime, go to our website at cbc.ca/Windsor. You can, of course, find us on social media. We're on Facebook, Instagram, and Twitter. Thanks so much for watching and have a great night.